proliferation of unregulated maternity homes caught the eye and the interest of my guest. Laura Morel is an investigative reporter for Reveal covering reproductive health and a fellow with the New York Times Local Investigations Fellowship. This report was a partnership between both. Laura joins us now by phone. Good morning, Laura.
Hi, Am. Thanks for having me.
Thank you so much for being here, Laura. How did you first hear about these homes?
So, I've been covering reproductive health for the last few years in Florida, and a couple years ago, I was working on a series of stories about crisis pregnancy centers. And it was during the course of that reporting that I learned about these kinds of homes. Historically, these places go back more than a century ago. Historically, these were places where unmarried pregnant women could go to give birth and then place their babies up for adoption. Most of these places shut down by the 1970s when birth control became more available. So I was really interested in learning about the mission of present day maternity homes and what it's like for women who rely on their services today.
And so this was an extensive investigation that you undertook. Tell us a little bit about the scope of the work that you did.
Yeah, so we know that there are more than 450 maternity homes in the US. Because I'm based in Florida, and because of the shifting landscape and abortion access in Florida, my story focused on this state where we identified 27 homes throughout the state. We ended up examining 17 of them by touring some of the homes, interviewing maternity housing providers, looking at codes of conduct that are posted on their websites, and also reading through police reports. In total, I ended up interviewing 48 people, including current and former residents, employees, and volunteers.
And so, what are these homes typically structured like in terms of who runs them, whether they're regulated, things like that?
Yeah. So they're often operated by charities. We found that most homes in Florida are affiliated with churches or Christian nonprofits. Many of them, as you alluded to, are also unlicensed and operate outside of state oversight. And I'm happy to get into that a little bit more. And unlike the homes of the past that I described, that were, primarily focused on adoption, homes today typically focus on keeping moms and babies together. The way that it works is that many allow expectant moms to stay there for free so that they can save money and be able to afford a permanent place to live. They're also helped with getting other resources like daycare vouchers and food stamps. And women often learn about these homes through either social services providers or crisis pregnancy centers, and it's their voluntary programs as well.
And so, you mentioned, the heyday of these homes maybe reached a zenith in the 70s when birth control became widely available, and the secretiveness around some births and adoptions diminished somewhat, but you've seen this almost like a nationwide renaissance. I mean, there's been this huge uptick in just the last couple years in terms of the numbers of these homes.
Yes, yeah, that's correct. Where and there's different factors that sort of lead to that. One of them is rising housing costs in this state and across the country, right? Have sort of led to this proliferation of these kinds of services. I interviewed several women who had full-time jobs, but still could not afford housing on their own as single mothers. So one of the only few options they had was moving into a maternity housing program. And the other sort of factor here that I think will see longer term impacts in the next few years is since Roe v. Wade was overturned, more of these homes are opening their doors around the United States. I think I mentioned, more than 450 in the U.S. currently. That number actually grew by nearly 40% in the past 2 years since Roe v. Wade was overturned. And we do expect that more homes are expecting to open in the next couple of years, as well as expand. A lot of these homes are also expanding their facilities so that they can serve more women and babies.
And so your reporting acknowledges that these homes are meeting a real need. Some cases, the women that are there are fleeing abuse. Sometimes they're women who have aged out of foster care, or some are, for instance, leaving rehab and really need a place that can restore them, give them a place to regroup, and as you say, save some money.
Yes, that's correct. These homes typically serve women who are in very, very vulnerable positions. Younger women, women that might be recovering from addiction, women who are leaving abusive relationships. And so it's a wide spectrum of different kinds of positions that these women find themselves in, and then ultimately end up going to these homes. I've interviewed women who were, left abusive relationships and ended up going to housing programs. Also women who, were recovering from substance abuse, as well as what I mentioned earlier, this sort of, third caveat of women who just could not afford a place to live, and had no, support system from family or from a partner. And the only option they had was to move into a maternity home.
And so all of that said, in your investigation, you found some concerns with some of these homes and their practices. So tell us a little bit about some of the things that you found that might raise some alarms for people um, learning about them.
Yeah, yeah. So we found three main things, and I'll just sort of go through the buckets. So one of the things we found was that many of the homes require residents to agree to strict conditions that limit their communications with the outside world, their financial decisions, and even their movements. There's one home in particular in Naples, for example, that required women to get permission before leaving the property, and they also had to download a tracking app on their phones. I also spoke to women who told me that they had to lock their phones in a safe overnight. We also found at least six homes mandated attendance at morning prayer or church services as a condition of living in the home. And these were activities that a lot of the women I spoke to said felt like religious indoctrination to them. Another sort of category was several homes also required prohibited cell phone use at night. So you couldn't use your cell phone after, 10 p.m., for example. And some homes also have a probationary 30-day period where you can't use your phone at all. So in interviews with some of the maternity home leaders I spoke to, they told me that these rules were in place in order to ensure the safety of the women and their children. But, based on what they're telling me and what a lot of the women I spoke to tell me, it's clear that there's a tension between the safety, of these women as well as respecting these women's autonomy.
If you're just joining us, we are talking about maternity homes in Florida. They're the subject of a new investigation by my guest, reporter Laura Morel. If you've had experience with these homes personally or you have a question or comment, you can join us at 904-549-2937. You can also email First Coast Connect at wjct.org or reach out on social media. Lauren, in terms of the obligations, for instance, attending a religious service, that can be common in some programs, rehab programs, I think of that very often are faith-based. But you found in some cases that the requirement that somebody attend a service actually interfered with their ability to keep their job, to keep their medical appointments. So it was a little more onerous than just, I think, maybe what we think of as a faith-based resource.
Yeah, yeah, that's correct. There were several situations that my sources described that sort of go beyond into this onerous category. One home near West Palm Beach, I spoke to a woman who had to quit her job so that she could make it to all of the required programming that included morning prayer and attending church services and other religious services. And I also spoke to another woman who was at a facility in Orlando, whose father had passed away. And then the next day, the women were expected to go to church. She asked to be excused because her father had just died, and the home refused to let her stay home. So these are just some of the, different sort of circumstances that come up, and that, show the challenges that women face when, these, church attendance, mandated requirements are in place in these homes.
I want to talk a little bit more about regulations, but in that context, there was one particular home that had a practice that seemed a little outside of bounds, which was requiring the women to turn over their food stamps. Tell us a little bit about why they were doing that, why they were asked to do that, and what you found about whether that was appropriate.
Yes. So this is a home, Hannah's home of South Florida near West Palm Beach. I spoke to several women and former employees who described this practice where it was required that women who were staying at this home had to turn over their EBT cards to staff, who would then use the cards to order groceries through Instacart. And I, spoke to a couple of government assistance experts about this, and they told me that this practice, seems very problematic because we're talking about requiring women to turn over a resource that's available to them to another agency that doesn't have any sort of state or federal authority to facilitate their groceries for them. So that on its face, was very problematic to some of the experts I talked to. A lot of the women I spoke to were also frustrated as well because they had no control of their EBT cards. They talked about putting together grocery lists and, feeling frustrated when the items that they had requested were not part of the orders ultimately when they got to the home.
Now, the person that you spoke to, the CEO of that home, denied any law violations, I believe, and said that that was just a sustaining practice for the home to be able to afford to feed the women there.
Correct. Yes, she denied the practice, and told me what I heard from other housing providers as well, that their housing program is filling in this void for housing assistance and for resources in particular to pregnant women. So that's definitely something I heard from women who stayed at this particular home. I think this is a very nuanced issue. I spoke to women who said they were grateful that they had this option to stay at, this home because they felt that they had built a community with the other women there. But at the same time, they just felt really oppressed by all of the different requirements that were expected of them.
Some of the other requirements, I mean, we've talked about the fact that there's some homes that require you to turn in your cell phone or lock up your cell phone. Um, but you also found homes that conducted random searches of the women's belongings and their rooms. One home required sexual abstinence from the women. Um, what did you hear about those practices? Were those kind of outliers from what you learned?
That was something that I found at several homes around the state. A lot of these places post their codes of conduct on their websites so that the women are informed of what will be required of them before they move in, and they are aware of the expectations required of them. And in interviews with the providers that I spoke to, they just said that it just comes down to safety. A lot of these women are leaving abusive relationships, or leaving situations that are harmful to them. And so for them, having these rules in place, um, makes sure that these women are protected from any further harm and trauma. But again, at the same time, right, there's this sort of tension between, safety and protection versus, respecting women's autonomy to make their own decisions. And it's definitely something that a lot of these requirements sort of rub up against.
If you're just joining us, we are talking about maternity homes and the resurgence of them nationwide and here in Florida. You can join our conversation at 904-549-2937. You can email comments or questions to First Coast Connect at wjct.org. Laura, you spoke to a former secretary of the Department of Children and Families, Mike Carroll, who himself is involved in one of these homes. How, what light was he able to shed for you in terms of the regulations that govern these, when they are subject to state regulation and when they're not?
Right. So there are three buckets of homes in terms of regulations. So those that admit minors that are in the foster care system, those homes have to have state licenses. So what that means is that those homes have to make sure that their staff meets certain training requirements, and that they also allow for state inspections every year. Then there's a carve out for homes with teenagers, and these are homes that are faith based and are voluntary programs. For example, parents, not the state, allowing their children to stay there, as well as homes that don't receive any government funding. So those homes can register with a Christian nonprofit that conducts its own inspections, and based on a review of the standards that we looked at, they require less training and formal education for their employees. And then there's a third bucket of homes, and this is about half of the homes in Florida. Because they don't accept minors and they only serve adult women, they do not have to be licensed by the state whatsoever. So these homes develop their own standards and their own rules. And what we found is that some of these homes are staffed by people who lack any sort of relevant professional experience. And when I spoke to Mike Carroll about this, he said that these inconsistencies in care and oversight are troubling to him, and that they can potentially lead to some pretty abusive situations.
And so when you talk about voluntary programs, those are programs where the parent perhaps is given permission for someone to be in the home. And if those homes don't accept government funding, essentially they are allowed to opt into this um, Christian registry that does its own inspections. You were not able to see those inspections though, is that correct?
Yes, that's correct. We reached out to this organization. It's called the Florida Association of Christian Child Caring Agencies. They're also known as FACA. We requested copies of inspection reports for their maternity homes, and the organization denied our request. They told us that they don't need to comply with public records laws because they function outside of the state's purview. But we believe that because the state has delegated oversight responsibilities to FACA, that they are subject to public records laws in the state.
And that's something you're challenging in court?
Yes, that is correct. The New York Times has filed a lawsuit, and the case is currently pending.
So we talked about the fact that housing prices are rising and pregnancy laws are tightening. Spell out a little bit more about how that plays into these homes and the need for them, and what your expectation is in terms of whether they continue to proliferate.
Right. Yeah, I think there is definitely a connection between the, astronomical housing prices that we're seeing, in the last year or so, and that we'll continue to see, with the need for these housing services. And one of the things that experts I spoke to that have also done research on maternity homes mentioned is this idea that there are very limited services for pregnant women, not just in the state of Florida, but in other parts of the country as well. And so a lot of charity run organizations sort of fill this need, where the state and federal government, has failed to meet these needs for these women. And so because of that, we do expect to see sort of a proliferation, a continuing proliferation, I should say, of these homes, not just in Florida, but in the rest of the country as well.
There are a few homes that you reported on that are specifically here on the First Coast in Jacksonville. One of them, the Divine Mercy House, you investigated in terms of whether they were as hard line perhaps as some organizations in terms of church attendance, and you found that the CEO there had a more lenient policy in terms of, I think she said that, if a child is sick, she's not gonna force somebody to attend church.
Yes, that's correct. I was able to speak with the director of Divine Mercy House in Jacksonville. They are one of the homes that requires church attendance. But the director of this home told me that She tries to be very flexible with residents and allows for absences, of course, when, someone's baby is sick or when they have, some other sort of exigent circumstances that they can't control. They also have a rule requiring outings longer than 30 minutes, requiring written notice with the director and subject to approval. And the director said, as I had heard from other providers, that the rule is intended to ensure the safety of residents, especially those that have left abusive relationships.
Or are victims of trafficking, perhaps in some
Correct.
way.
Yeah.
Yeah. You also spoke to and looked at the in ministry in Jacksonville. That was one of the facilities that requires women to turn in their cell phones overnight.
Yes, the in ministry in Jacksonville. I spoke to the director there, and she told me that residents are required to leave their phones downstairs at night. And this is a rule that was instituted, she explained to me, in order to prevent disruptive conversations. So if somebody's, talking on the phone in the middle of the night, that may be disruptive to other women who are also sleeping in the rooms next door. But she did explain to me that in case of an emergency upstairs, the house does have a landline telephone upstairs for emergency use.
There are some practices that seem like they make a lot of sense at these homes, but they've also led to some really difficult situations. For instance, one home I think reasonably had a rule against, no fire, nothing incendiary, but a mother lit some incense in her room one night. What happened? That led to a pretty dire situation for her and her children.
Yes, I spoke to one woman who was at a home in Melbourne, Florida, and she lit incense. She said she didn't know that that was a rule violation, and she was asked to leave the property at night with her two children who were sleeping. She called the police as well as the home, and the home ultimately agreed to put her up in a hotel for one night. But her situation is definitely something that I heard of repeatedly throughout the course of this reporting. Is just that residents faced very serious consequences for violating these arbitrary rules that often led to either eviction or also to the homes calling the police on the women as well.
And so she was evicted that night. The home agreed to pay for a hotel for one night, but that afternoon, she and her children and her pregnant self were um, without a place to stay.
That's correct. She was actually not pregnant, but she did have two very young children. And yes, after they checked out of that hotel the next day, they, were without permanent housing once again. And she ended up going to a friend's house after that.
Well, Laura Morel, a very interesting report. She is a reporter for Reveal. She is also a fellow with the New York Times Local Investigations Fellowship. This report was a partnership between both, and you can find a link to her reporting on our website. Laura, thank you so much for joining me this morning.
Thank you.